live in Oakland, California.
You live in Oakland.
Yeah. How about you? You're in East Coast?
I'm in DC. Okay. I have a daughter who lives
All
in
right.
LA, so I've spent more time
Let's get
on the
started.
West Coast this year than I have probably in the past 10 years.
All right. Everybody. Hello. We're going to get started, everyone. Please find a seat. Hello. All right, wonderful. I'm Alice McCown. I am publisher of The Atlantic, and I'm here today on the most amazing International Women's Day. Woo! And we are here to discuss the other half, advancing healthcare for women. And I am so thrilled and so proud to be on the stage for these incredible women who are working towards advancing healthcare for women. So I'm going to start with introductions first. I have Erica Taylor over here. She is Vice President and Chief Marketing Officer for Genentech. Dr. Sharon Malone, who is Chief Medical Advisor for Alloy, best-selling author, Grown Women Talk. And then Maya Dusenberry here, also author, journalist, most recently of Doing Harm. So again, we're going to have an incredible conversation today. We're going to weave in a little bit about International Women's Day. So I'm going to kick it off first. I'll start with Erica, and we'll move down the line. So this is where we're going to talk a little bit about opportunity. And I want to talk about where and what do you see is the sort of most overlooked and misunderstood aspects of women's healthcare right now, and what are those things that deserve our immediate attention?
Yeah, so thanks, Alice. Thanks, everyone. Am I on? Can you hear me?
I think so.
Okay. So when I think about what's overlooked in women's healthcare is sort of, I think of it as, I think most of the time women are considered biologically identical to men, except for what I'll call bikini medicine, right? That which makes us, from a reproductive standpoint. And what that means is we miss on so much of really different biology that women have as a whole person. And so, for example, less than 5% of research and development funding goes toward women. And so when you think about what that means in terms of the gaps in understanding, and they show up in everyday life, such as symptoms for stroke are different for women than they are for men. And so very often, something like 25% of the time, women are misdiagnosed for stroke because they do not present in the same symptoms that have been studied widely in men, for example. So we're really working actively to increase our inclusive research efforts so that we are including women more frequently in our studies, higher percentages for any medicine, for any therapeutic area that we're considering.
Wow, those are some stats. Dr. Malone.
Yes, and thank you, Alice, for this. This is a wonderful opportunity because I think one of the areas, and there are many when it comes to women's health that are overlooked, but my particular area of interest is women's health in midlife. And this is where we start, and we start talking about perimenopause and the menopausal transition, because that ushers in so many other health problems that start to show up in midlife. And I think that what we have to understand is that, we in the medical profession, and I'm an OBGYN, and I practiced for over 30 years before I joined Alloy Women's Health. And the one thing that came up again and again and again is that we doctors just don't have the time. And we've got to figure out how to leverage the technology that we have to be able to deliver the care that we want to give. And I don't think that your doctors are really out there trying to do a bad job. They're not, but understand that they're stressed, and there's a limit to how much can be done in a 5 to 7 minute visit. And so my new focus in life is to make sure that every woman in midlife gets access to the same information, the quality information, and access to care when and if it's appropriate. And that is really our mission at Alloy Women's Health, because we're trying to democratize healthcare. It shouldn't matter where you live, whether or not you get access to good care or inadequate care. And that's the need that we're really trying to address.
That's great. And then Maya, I'd love to hear from you.
Yeah, so I kind of came to this topic 10 years ago as a patient initially. I had an autoimmune disease, and like so many women, had experiences, trying to get diagnosed that were less than ideal. And once I did get diagnosed, heard a lot of stories from other autoimmune patients who kind of told similar tales of being dismissed by their doctors. So the book I wrote kind of was an attempt to explain what the problems are that underlie those kind of experiences. And I really came to see that there are kind of two problems. There's the knowledge gap that Erica talked about. Women have really been left out of a lot of clinical research, but there's also this trust gap. There's this tendency to dismiss women's symptoms as stress or anxiety. And as a kind of feminist writer coming to this topic, I think that part of it was the most kind of shocking to me, to realize that even, in 2025 now, this is the space where even very kind of privileged, educated women who have a lot of authority in other parts of their lives often feel really disempowered are often just not listened to. And so I think, we're making a lot of progress, I think, on recognizing the knowledge gap. And I think there's still, within medicine, lack of awareness about just how often that kind of dismissal happens.
Yeah, I mean, I see a lot of people, I think, nodding their heads. I think we've all had these experiences, and I love each of these points. They, I think, really hit home with a lot of us. So, Erica, I'm going to ask you this one specifically as the Chief Marketing Officer. So, many brands think about International Women's Day, and the first panel just talked about this a little bit too, on sort of what are traditional concepts. But from your perspective, what have you seen in women's healthcare or otherwise, like specific examples of campaigns that have really resonated with women, and why?
Yeah, I think, and I loved hearing it from the previous panel. I think, the consistency, I'm talking with women and not at them. The way we think of it sort of from a marketing lens is no one likes to be marketed to. If the best marketing doesn't feel like that, it feels authentic. There's an element of storytelling to it. And it feels like it resonates with you and your own lived experiences. And you can only do that when you're doing that in collaboration with the people you're trying to reach, and you do it consistently over time. So these sort of point of time moments like International Women's Day, and someone sort of parachutes in and says, "Look at us for women,"
right.
and then you go away. We're all in here smart enough to recognize when you're sort of being pandered to, frankly. And I think some of the best campaigns don't do that. They happen over time. They're built with women. They have an element of storytelling. I fundamentally believe that marketing is storytelling. One of the examples that we have had a lot of success with was really focused around screening for breast cancer. And we did this partnering with women of color, writing love letters to their loved ones, encouraging them to get screened. Because the fact is, I personally feel bravest and strongest and the biggest advocate when I'm doing it for someone else, right? Maybe less so for me. And so we really kind of leveraged that insight to say what it would be like if I wrote a love letter to you, imploring you to go get yourself screened, and that the impact that has in both directions. We've gotten a lot of traction with that campaign over the last couple of years. And so when I see those kinds of examples where we're really working with the people we're trying to reach, doing it over time with consistency and an element of storytelling, I think is really where I see the most power in campaigns.
Agree. So I'm curious, Maya, if we're going to talk about the patient perspective and talk a little bit about brands, from where you're coming from, what do you think is the biggest disconnect between sort of what brands are marketing to women and what they actually need? So just I'm curious from your perspective, and how can those brands sort of bridge that gap?
Yeah, that's a good question. I think it's interesting, we heard this a little bit on the last panel, the way that brands are kind of stepping in to provide a source of community for women who are really hungry for that, for sharing their own experiences, for connecting with other people who have similar experiences. And I don't know, I guess I see that as both, obviously an opportunity for brands to step in and do some good in the world, and also a kind of reflection of the problems in the medical system. And I wish that there were, that wasn't, there wasn't such a need for that, and that women were finding spaces where their experiences were validated by the medical system, maybe finding more kind of non-commercial spaces to connect with other patients. but yeah, I think it does speak to the fact that women are, I think, hungry to be taken seriously, to have their health concerns taken seriously, and their voices more generally kind of treated with respect.
Yeah, I agree. So Dr. Malone, I think from the doctor side of the standpoint, what's your sort of perspective on that? Where do you think there is a disconnect between brands or not in what women actually need?
Well, you know what, as in OBGYN, this is one of the few fields of medicine where it is actually advantageous to be a woman.
Yeah.
Because you understand the things that you're talking about.
You know your product.
And, I wouldn't recommend that your brain surgeon have a brain tumor, but this is very actually helpful. But, this is what we brought to Alloy. Our founders, Ann Fullenwider and Monica Molinar, actually came to this space because Monica did have the experience of having an early menopause. And her experience, the same thing, going around from doctor to doctor, not being heard, not being seen, and not getting the care as a 40-year-old woman who was experiencing this should have. I come to this from the perspective, I'm a black woman from Mobile, Alabama, so I understand what it looks like on the other side of that desk when you are talking and trying to get your needs met. So, when you collide between, sexism, ageism, which we are not seeing, and the aspect of being a black woman trying to get your needs met, it's a problem. Yeah. And so we come to this space trying to provide women's health, knowing each of us has a unique perspective that we can bring to that. So we come to women's health with a position of authenticity because we are not solving your problem, we're solving our problems. And we know best how to do that because each of us has our own personal experience. And I think that a lot of brands, don't understand that. The same thing as we were talking about before, you're not just talking to women. We understand where the gap is, and I think as a physician, I also understand what the limitations are in an in-person visit. And that's the problem we were trying to solve. And I think that if we can do that, then we have done our job. But we've got to leverage the technology that's available to make sure that all women, not just women who live in big cities or have access to concierge care and can spend thousands of dollars, but all women have the ability to access care, to be able to create community, and to access treatments that are effective and safe. Because we also have to be careful because there's a lot of, people have sort of awakened to the fact that, when the women's health market is a growing industry. So who do you believe? And that's, I think, our stock and trade. Is providing that authenticity from the perspective of people who we're not just talking about it, we've actually been there.
Yeah, that's a great perspective. I'm curious, Erica, what you see just from a disconnect standpoint and how to bridge the gap. I think you've sort of talked a little bit about it too, and I think you guys are saying similar things. It's like the community and then the access and that's authenticity as well.
Yeah, and I think even pulling your thread on just understanding what is different and what can we see and understanding conditions that affect women differently. And so you talk about the sort of what we're trying to do around menopause and what you're doing there at Alloy, and really proud of Genentech actually has a menopause benefit specifically for symptoms that are experienced by women.
Awesome.
And we introduced this a few years ago. This is personal to me because I'm perimenopausal, and so I'm actually thinking about what this is going to mean for me when you think about these are women in the prime of their careers. Right? And at often the pinnacle of their careers, I'm really affected by this. And so some of the gaps for me are not just awareness and understanding, it is what is the action that I can take, right? I think one of the things that we see is, yes, information, yes, very important to have, but really advice on what is the action I can take, what are the sources of data that I can trust, and what can I do about that? And so we have been really active in our global women's health initiative, both for information when it comes to what we understand about the biology of disease, what we understand about the treatments and where they work, but how do we make sure that there's a clear call to action that is relevant in various countries and disease states that we have for Roche. So there's a lot to do around the gap, and keep keeps us all up at night around when you think about what happens if you don't have that access, you don't have the understanding, and you aren't able to take action.
Yeah, and I mean, I love that sort of women in the pinnacle of their career, specifically on the menopause point. I personally suffer from brain fog every now and then, and it's like you're in the middle of doing something and it turned into a charades moment. You're like, sounds like that word, looks like, no, it's real. It's really like, and like people are guessing the word you're trying to say. Yeah, it's real.
Yeah.
Okay, so let's talk a little bit about clinical advancements too. And Erica, this is going to come right back to you. Hold on, let me get this specific question here. How can companies innovate in this space around clinical advancement? How can they communicate and support women on their healthcare journey?
So I'll take it in kind of two spaces. The first is how we research and develop medicine. One, I said earlier, we need to make sure that we are building inclusive trials, but that's not, to your earlier point, Sharon, around having access in urban cities. We need to find a way to make clinical trials meet the needs of the patients we're trying to serve. So that includes things like what we call decentralized trials. What does that mean? It means you don't have to go to Sloan Kettering every month to get monitored. We actually find a way to get you monitored in your community, leverage technology so that the investigator for the study has the information, allowing it to work around your schedule. So we're beginning to experiment with things like that, how we're able to just expand the availability and access and inclusivity in our clinical trials. If I think about it on the other end, once medicines are approved and, as we call it, in market, how do we make sure that we are ensuring that patients do have access to the medicines that we do produce? One of the things that I'm very proud of is we have Genentech Access Solutions, which are our internal patient navigators that help our patients understand their benefits, understand their out-of-pocket costs, understand their options for lowering out-of-pocket costs. One of the things that we do as a part of training new people that come into Genentech is they can sit alongside our members in our access solutions they sit on calls with patients all day. This is all they do. And it's really powerful to hear the conversations that are had. All the other things outside of healthcare influence into those conversations. Inflation, how do I get my ends meet? How do I get my medicine when my spouse or my partner has lost their job? Like all of these things sort of start to fold in, and we take a really personalized approach to ensuring that we're keeping access once the medicines are available. So you have to do both, in my opinion.
Okay, so I think today, we think about International Women's Day, we're celebrating, but it's also a moment of reflection. So Maya, I'm going to start with you. Like, what recent initiative have you noticed that you think is truly moving the needle for women's health? Where are you seeing optimism?
Well, I mean, I think at the end of the last administration, there was a lot of optimism around the White House initiative on women's health. I think that was a really important step forward that provided huge amounts of funding and also kind of the recognition that this knowledge gap still exists and we still haven't fully closed it, and we need to devote a lot more resources to studying things like menopause and endometriosis and tons of women's health conditions that have really been neglected. And yeah, I think that is important, and I think hopefully will continue, but of course we are in a very different administration that is cutting funding for the NIH across the board, that has a DEI initiative that basically, is flagging even women's health as one of the terms that studies are not supposed to talk about. So I think, just really underscoring that that sort of awareness about sex differences and neglected women's health conditions is not something that's going to continue in the next administration. And so that's not the hopeful answer you were looking for, I think. But
So, Dr. Malone, do you have something that you think you're most proud of that you think is truly moving the needle?
I do, because, people who know me know that one of my favorite sayings is there are no accidents in the universe. So I went from clinical practice to joining Alloy Women's Health, where I actually got to use that clinical expertise and to leverage it over hundreds, if not thousands, of women across the country. But as I started doing the research for my book, how it's bad, but you didn't know it was that bad? I was like, wow, it's worse than I thought. There has never been a more important time when we're talking about data and research into women's health. One of the, to talk to the issues of diversity. And I think that the reason why we have not gotten the answers to so many questions that span women's reproductive lives is because we haven't had people asking the questions. So the researchers who are there, if you have all white men, then they're going to pay attention to things that affect white men. We need to have diversity. There's never been an opportunity for us to, at least, well, we may have lost that one in the last administration, but to understand that conditions affect women differently. There are conditions that affect Black women's health, Hispanic women's health, Asian women's health differently. And it's not because we're looking for some great genetic difference between them. It is because the lived experience of those women is different, and it affects them differently. And I think that all of this is to say that it led me to another part of my career that I didn't know I needed to be a part of, and that is to be a women's health advocate. And Jennifer Weiss-Wolf, who is here today, has really done a phenomenal job. We've done a lot of things out in the policy space. She's a lawyer, I'm a doctor, so we're a perfect team for making this happen. But there is, I want all of you to know that there is a Citizen's Guide to Menopause Advocacy, which, you know, I'll be happy to share the link with you, but it is the concrete steps that each woman can do, because I think that we have to advocate not only for ourselves individually, but we have to realize that collectively, we're a huge force in this country. And let's not forget, the largest funder of research in this country is still the NIH. And at the time of the writing of my book, the $45 billion budget, less than 11% of that went to conditions that primarily or exclusively affect women. And when it comes to women in midlife, it's, you know, it was so low they didn't even track it. So if you know it, you know, as we say in the words of the great Biggie Small, if you don't know, now you know.
I love it.
I want you to use that information to say, wow, didn't know that. Let me go get this Citizen's Guide so I can figure out what I can do, because this is a lot of the issues that we deal with are not just about biology, they're policy. It's regulation. It is all the things that have to do with how we move about in the world as women that have nothing to do with us. And unless you can disaggregate that data, you can't lump us all together. You've got to be able to look at women, men, Hispanic, Black women. And that, I think, you know, aside from the work that I do in the perimenopause and menopause space, that has probably been the most exciting thing that I've been able to do, is to realize that, let's look at all of it, not just one piece. That's
incredible. And I think that's something for everyone in this room to think about, like we can all work together on this. So one last sort of lightning round question here. So as we mark this day, what bold changes do you envision for the future of women's health care? So Maya, what would you envision? What would you project that you would love to see?
Let's see. I think one thing I'd love to see is innovation around diagnostic errors. So you know, we've talked a lot about the way women's symptoms are often dismissed and they have to go to doctor after doctor. And one of the big takeaways from my research was how that sort of diagnostic journey often doesn't end in the doctor like learning from it, learning that, oh, that woman actually, you know, had an autoimmune disease or ultimately was diagnosed with this condition. So I think there's a lot of kind of unrealized potential and kind of putting better systems in place so that that learning does happen, and that women don't just kind of go to doctor after doctor and then kind of fall off the radar, but they get that feedback, and that would, I think, help kind of close that trust gap.
Good technology opportunity. What do you think, Dr. Malone?
I think that there's an enormous opportunity to use technology and not be afraid of it. I mean, this is a place where artificial intelligence has got to be a piece of it, because we cannot pipeline ourselves out of this problem, the access problem, and being able to democratize care and information. So we have got to be able to use the ability to leverage artificial intelligence, because what artificial intelligence can do that one individual doctor cannot do is that it has the ability to see all of you. You know, if you have all of the data, then I know about what happened when you saw your endocrinologist, or, you know, what happened when your last EKG. And that is something that, as we have siloed medical care out, we're still practicing medicine in 2025 like it's 1925. And it's time for us to really realize, yeah, we have the ability to have all this information and have it, you know, in one place, such that we can treat the entirety of the patient and not just their parts.
Yeah. Erica?
So I'll maybe combine both of what you guys have both said, because I wholeheartedly agree. I think there's an element of learning here that can be enabled by artificial intelligence. And to me, the ultimate goal is to make it such that innovation isn't synonymous with exclusivity, right? If we at Genentech are really focused on innovating in the highest unmet need disease areas, and typically innovation is only reserved for the select few. But if we can take the learnings from clinical practice, if we can leverage AI to actually understand the whole you, we can make it such that you can have innovation as synonymous with commonality. Everyone can have access to that. I think that to me is the bold change that I'd like to see in the future, and I think it's possible.
That's great. So I think just to close it out here, I think what I'm hearing, I think what everyone in this room is hearing is community is incredibly important. We're all here. We can spread the word. Access, whatever we can do to help increase access for other women. And then really, there is technology and innovation for good, and like lean into it, and it can help, you know, solve a lot of our problems here. So anyways, really, really thrilled to be here. Thank you, Erica, Sharon, Maya, and happy International Women's Day.